nhớ rồi hỏi cho tên này chết gì bé trồng hông đợt nó cũng ya phát hành có gì sinh là hoa mùa xong nó mới ít tu cam mò covid cầu chua với giờ sống trai thiê sơ sinh thiê vật trò mua nâng ta chỉ nâng
Professional COVID Go Chua Equity Project nói giờ trừ lon tờ lưu dây rò có ba cho kế sĩ kiến tờ tu ca mua COVID Go
Available by the thousands in Northeast Wisconsin, and all you have to do is sign up. But XuvXwm says it's not that easy for a Fox Valley community that's been hit hard by COVID-19.
Out of the number of deaths that we have, which is about 20 since October, about 16 of it have been COVID.
For others, the worries of the pandemic have taken a toll.
Especially the older population, they are definitely living in fear of getting this virus.
Now some local organizations are doing their part to put a halt to
Under
that.
that mask, a smile, perhaps a bit of relief he's finally getting a COVID-19 vaccine.
We are given 200 vaccines a week.
That's Dr. Yumeng David Tao, president of the Hmong Medical Association, or HMA. And this is Phelan Family Pharmacy in St. Paul. It's one of the 20 small pharmacies MDH is granting doses of vaccines to through a pilot program aimed to serve communities of color. Just last week, MDH said it needed to expand to more community pharmacies like Phelan Family. The move welcome because HMA members have heard from the community.
A lot of our physician and healthcare providers would have Hmong who are 65 years and older, and their major complaint is that I can't get the vaccine. I can't even
access. Omicron B11529 variant. What the health official mo ki chơ sang hang vì New York tu camo ki tàu sai thiết long tàu chẳng hang. Tu camo chia no chẳng po shi cha tu Delta variant lợi thia. Dr. Fauci ยังต้องไปสั่งอเมริกาก็มูซากงชัวบูสเตอร์ชาวิตุกามอโอไมครอนนอกีโตโตเชดอเจอเตียนในตื้อชาชัวโควิดโกยัวตาลา
Welcome back to another episode of Hmong American Weekly, a Sunday night discussion about building political consciousness and power in the Hmong community. I'm joined this evening by my co-host, Terry Tall, an adjunct professor at Metro State University and the chair of the East Side Senate District 67 DFL party, and my aunt, Paku Heng, a community activist and political scientist. For folks who don't know, we began this show right after the 2020 elections because there were a lot of disinformation being spewed in the Hmong community, and we believe that the best way to combat disinformation is to build a resilient political consciousness, hence these weekly conversations. I know that we haven't been on as much as usual due to a lot of activities going on, but we are still hopping on the show once a month. And so for those folks who don't know, we also don't hide the fact that we are all Democrats and we see this show as a part politics and another part civics. And so while the elections is over, the work to build a resilient political consciousness and political power in the Hmong community continues. And so, Terry and Paku, how have you both been?
Well, I've been good. Thanks for asking, Jay. You were going to ask a question. It's interesting as we talk about COVID. I was just in Los Angeles for the BTS concert with my sister and my daughter, but everybody had to have a vaccine card to go into the show or had to show proof of a test. And there were 70,000 people there. And when we came back, I quarantined my family and we tested negative. So it means we can do some activities safely, but I was really impressed with the fact that, we were, that we could do it. I mean, even though we'd all been vaccinated, even boosted, we were still always a little worried, right? And so, so even traveling on airplanes and everything, it's still very much a worry. And so, but it felt good to be out of town for a little bit.
Great. Terry, I was so jealous actually when I saw your pictures on Facebook. I've been doing well. My family had a really wonderful Thanksgiving and, we were still very vigilant because in our family, we have someone who is medically very vulnerable. So we were still very vigilant. And I think that that's why I'm really excited about the conversation today, because I think that a lot of folks are thinking, just like what you were, Terry, you were saying, they've got the vaccine, they've got boosted, and they're like, oh, I'm okay, I can do a whole bunch of stuff. And they're not as vigilant as they should be. And so I'm excited about this show. And of course, I'm still cautious about COVID. Jay, what about you? What was your holiday?
Oh, well, I've been just traveling. I just came back from a conference in Vegas. And folks down there do not really mask up. And I was very, very conscious. I had my N95 mask on over another mask. And one of my other peers went with me, and I told him, "You're gonna be here with me. You better mask up because I don't want to get anything." Oh, and then I also just came back from this weekend from a retreat with my colleagues up in St. Cloud, but we all were very, very, very conscious, and that goes back to why we are having this program tonight. Cho có biết bắt đầu lúc chạy nhau từ especially with the Hmong chốt là cho căng lúc sĩ công nó cha biết cho lo your Christmas or more Thanksgiving là bé sound sĩ tham mình chỉ sửa ta you know xong nó tổ lúc xong nó point to come on cứ ni pain đầu dạng chỉ trong cho biết chỉ tôi nên mong là biết cho ở tụ qua chỉ sinh cái tổ chức thằng Terry các bạn Kaab short to corner there.
Yes, so tonight we're really excited to have two members of this amazing new organization, the Hmong Public Health Association, that just started up not too long ago. And tonight we're joined by two members, including the chair of the HPHA, Mai Bu, and then Jason Jinu Ya, who is also the policy and advocacy lead for the Hmong Public Health Association. So Mai is actually an epidemiologist, and she's currently right now is in New York State, working at the New York State Department of Health. And so she actually did her master's degree in maternal and child health and minored in epidemiology and global public health here at the University of Minnesota. And so she graduated just a couple years ago, but she particularly has been doing community-based research with underrepresented populations, including pregnant women, populations of color, immigrants, and refugees. And Jason is very passionate about working with Hmong youth and young adults to help them navigate their Hmong American identities through script writing. But he's a strong believer that public health practices can address health issues and understands that public health intersects with many other disciplines. Currently, Jason works as a community education program manager at the Community Engagement to Advance Research and Community Health with the Clinical and Translational Science Institute at the University of Minnesota. It's a full thing, but you're doing work, doing research, both of you, which is really, really important. So as we said that, I'm just so amazed always when I meet amazing Hmong American professionals in the community. And Mai, in particular, your role as the chair, right, of the HPHA, and in particular working as an epidemiologist. Could you talk with us a little bit more about what HPHA does, and in particular what an epidemiologist does? Because I don't think people knew much about it, but it's also been in the news quite a bit recently too.
Yes, thank you for that introduction, Terry. First, I just want to say thank you for inviting us on tonight to speak to you, to educate and inform viewers about COVID-19 information and vaccines, and that we do want to share information with viewers so that they can make informed decisions to protect themselves, their families, and friends as they go about their daily lives and try to get through this pandemic. And so before I answer any questions, I just want to be clear that the Hmong Public Health Association is not affiliated with any political party, politician, or campaign. We're solely dedicated to the field of public health and working to advance health in communities. And our work and our approach is nonpartisan. So going back to your question, the Hmong Public Health Association was formed earlier this year, as Terry stated, as a result of the COVID-19 pandemic, actually, and the need for Hmong public health professionals to come together and address the disproportionate impact in the Hmong community. And HPHA's mission is to serve and foster a collaborative community through shared resources and networks for Hmong public health students and professionals at all levels. We're made up of over 30 Hmong public health professionals and students across the United States. And we reach over 6 unique geographical communities, with the majority of our membership representing geographical areas where there are concentrations of Hmong communities, including the Twin Cities. Additionally, we operate as a volunteer-led organization with broad professional public health representation. Our members and our leaders come from all sectors of public health, including academic research institutions, nonprofits, and state and local public health departments. And we all work in, diverse public health domains, like infectious disease, surveillance, health education, disease prevention, chronic disease, everything. So as for my role as an epidemiologist, by definition, we are public health workers who investigate patterns and causes of disease and injury. And we try to use that to reduce the risk and occurrence of negative health outcomes through research, community education, and health policy. And so I feel like I have a unique role as the chair of HPHA and being trained as an epidemiologist, because my intersectional experiences provide me with a public health focused lens where I'm able to analyze and interpret data, conduct research, and disseminate that to the Hmong community, right, who have been historically underrepresented and overlooked. And so I'm happy to bring my skill set to the Hmong Public Health Association so that we can continue to move towards a healthier, environment and community.
Great. Well, thank you so much, my view. And welcome, Jason. Yung Shahin, ta no ko ton rube shikong. And so Jason ko bao hata ko ha mai mai online yo o tu thai cho the lu ko hao Hmong Public Health Association. And no ko jong shai de ko ton rube shikong ha. Ko no ko hata o pe lin ma pe no su COVID ma mo ito tong ning po ta ku tu san kong ti o ta ku ta like booster ta ku ying jong le. And they also know from Lu Jake hata po mo itu COVID cha na po ya itu mikamo hu variant cha mo rong nan tao tu ning shi tan su COVID ma rong la ko ye de tu ning ku chi bao na la ku no to kon tao me che ku yin ya chne ku yin chi bao sa na ku san bao hata ka bu kan ka pe de ta shno cho ko mai ju COVID ko cho no ya a chi ta ha ka che ka pe hata cho tu ning ho pe lu Hmong community na po ya po pu thơ cho chne cho lu cho tôi nên bị CDC ha bố bù bang po the king ha lo từ tại sao có bộ buổi cho con AG or con nhua sáng từ COVID-19 ha bị trừ mong.
Yeah, so我就包括个就那个路贴，so one day 我这个路就边边这点so in the HPHA I serve as the policy and advocacy lead in the policy and advocacy committee, and so some of our responsibilities is collaborating with community partners on HPHA advocacy and policy initiatives, and so in that aspect we some of our activities include writing policy briefs and reports, letters of support to support different initiatives in the community. And so ก็เรารู้ก็ให้เตียเกี่ยว guidelines แต่ชิโนก็ที่ไทยโควิดก็จ่อยได้จริงหรือเปล่า
giờ mà cho cô mày national nhớ thì á chne nhớ từ COVID có cho yo chi tôi nên nhớ bị chết rồi là bố hạ cho bé ha thay ta bị the king the COVID-19.
Oh yeah, chịแต่ฉันนอจอลูไปเจเดอร์เลยให้ตัวเทียนยอดตัวตีMinnesota Department of Health เทีย Ramsey or St. Paul Ramsey County Public Health เทียจอHealth Department ยอดเราโหสิง Minnesota นะเจเลยแต่อยากให้เตียก็ชัดชัวร์โตนะเจก็หมดชัดกงชัวร์ที่ไทยเขาไปกงชัวร์เทียอยากแต่ก็ชัดตาเหลือเนาะเทียอยากแต่ก็ตอลีอยากแต่ก็ชาจอนสันอยากแต่ก็ตอลีออลฮีนะเจหมดชาก็กงบูสเตอร์เฮ้ยก็ชาต่อกงไฟเซอร์แต่ก็มองเดินนะเนาะเจก็ชาต่อกงบูสเตอร์ต่อการเจ้าลีก็กงที่อ๋อเจเลยแต่โซอีอยากเจหมดชาชั่วที่ไทยก็ตัวเข่งเทียที่ไทยก็เจนิ่งเทียจะพงยือ๋ออยากแต่ก็ย้อนตัวดูเดินเดี๋ยวจะที่นิ่งสื่อลีเองย้อนลีตัวฟีเจย้อนดูเดนนิ่งก็ชอบย้อนใจเลย khó bé nó chỉ thôi có tờ có trong khỏi mua khó tư xử lý mua nó mua nó mua cổng lúa mua bê ta la lông lúa khư khẩn vô thia khẩn chứ thôi giờ thì có thể liên chỉ kỳ tao cho tín hình khó bao nó chỉ dạy thì có dạy thì có móc cái thua nông miền chỉ lon chữ cái là thì có nhớ chế li có bao nữa tao có chỉ sau mò lại có mà li đã cả tự trong thì mua hồ lưỡi thì li chỉ kỳ đầu tiên nên chỉ khó chỉ nó chỉ dạy thì có tự trong thì dạy thì xử lý thì có hồ lưỡi có nhớ tao bị chế có tao hồ lưỡi nữa chỉ lại thì có mua qua sẽ có bộ mò COVID nữa còn là thì bao hay thì ta guarantee thì có chỉ mò cái thì chỉ kỳ đầu lựa tụ nên xử lý chế nên là chỉ nên có hồ lưỡi đó chỉ khỏi là hay nóถ้าเขาเกินnó chỉ lại tiệt ya tiệt tao nó chỉ做 daily nên có phim or nên có seconds 但是佢只不定人nên có phimถ้าya tiền做 tao day nó chỉ she hand sanitizer cáiอยู่ใช้ day ได้เลยหูเนาะ
Good. So Jason, really ka hama really jo Minnesota Department of Health bo yin ha ta country dai kong really operation ta to in yoko bi hu bo yo yin ji zai hin.
giờ nếu những chỉ sợ mình chỉ theo đó họ ta chỉ nói chỉ bé giờ li bé tứ chỉ hiểu taoอยู่lo hiểu nó thìอยู่lo tao bé hiểu nó nữa chỉ ta chỉ nói bé bảo rong hay thì trâu là khai nhận的nó giờ thì是的 practice 了，要的是的是工地我下到了下呀，那些题材都是的都干嘛口味个做的哩只起到都热上呢。
Jason, cho lực cái Department of Health bắt đầu chọn tờ ở nhà thì tăng lên nó có cụ hạt ta mỗi từ tôi nên cứ muốn chân chân New York chắc chắn luôn cứ nhớ từ bên sinh cho cứ làm sao ta nó cũng muốn tàu kỳ tàu từ cam variant cha nó cái gì tham mình chỉ từ variant cha nó sẽ nhiều lấy chẳng ha của big chế tôi nên mong có bảo thủ tại nên họ impact nhiều lấy chẳng
tao cơ mà so từ liệt họ cụ báoแต่ฉันnói chuyện của hay đâu sở đó đây thì cụ chiều hồ lớn đó same program thì county public health với cái cụ chỉ báo cụ chỉ updated là chỉ cụ chỉ báo cho số sự chiaแต่是cụ cho báo họ cụ nhận thế họ cụ nhận họ MDH website này cái từ liệt họ bé báo cáiตัว Omicron variant nó là chỉตัว COVID chia tại nói cái nu这里了上主了是 research 嘅呢让记到用语上呢呢记到用语上差到 Delta variant 了跳จะ可能猜到一啲寧下呀記用語貼嘅要做嘅你哋學大家冇係嘅做 guideline 嘅要做到對做 guideline 都學到加摩nó你記用語向呢貼佢別到rồi giờ mong theo cái tin cha sẽ được bảo vệ thì tổ chức móc khẩu của cho nó chế thầu nữ tới từ chia chế trong cái li mỗi bị sai ya tới từ nên cái bị nó có bị sợ ban đầu nè ya thầu nữ nó có bị sợ ban đầu nữa chỉ sợ ban đầu nữ tới rồi sai công cụ tới rồi sai cho lo有给了nữ sợ khó ban đầu有给cái nữ chỉ sợ cái nữแต่เราตัวมอกี่ตัวก้ามอตรงนี้นั่นน่ะกี่头都有熊子天有冇卷子嘅有即時班到嘅有我到處用啦嘅到 COVID 個咗嘅種呢嗱頭呢那個邊摩到我盤那個那個邊摩到嘅到 COVID 個咗呢知道包蛇班到你知道包曬啲人有曬咗落地但是但係到我用嗱嗱嘅到 COVID 個咗嘅種個呢度呢嘅即係蛇班到啊見到包地有幾粒咋幾容易咯有我哋家聽領導嗱嘅依啲乜比賽俾一啲呢嘅意向俾近子嘅但係呢COVID 個咗嘅種領導嗱意向嘅你幫子意向嘅你攞咗意向嘅你攞翻自己包打咗嘅但係呢哋叫到 COVID 個咗種領導
即係佢哋嗰啲論字所但係呢個報道包報道部department 喺度參對老師呢但係俾每條網佢冇到幾度咁我查to variant channel
พอปตากุนก็ใช้ Minnesota Department of Health web page เกลือตัวชัดให้เดี๋ยวไม่ตัวเชียแต่ฉันมาอย่าตัวตัววัติเปวัติเราให้ใครแต่นูมูที่นิวยอร์กหล่อหน่อยนึกกี่ตัวเดียวเกแต่ฉันเขาก็เป้าเกจุดตัวเดียว
Thank you. You work closely with the Minnesota Department of Health on data disaggregation standards, right? And making sure particularly Hmong people get counted in that. And you're getting these monthly COVID updates. Minnesota right now still continues to be a COVID hotspot. What's causing this, and what are the recommended practices, and why is it so important for our community to continue following the CDC guidelines?
Yeah, thank you, Terry. First, I just want to be clear that we're not COVID-19 experts, right? And so sometimes it's hard to have all of the answers, especially when COVID is changing so quickly. And so just to clarify, our monthly meetings with MDH are not to discuss COVID rates and vaccinations, but to discuss our efforts to create a statewide demographic data standard that will not only impact COVID-19 data collection, but all standards for any healthcare data collection, right? And so, as I stated earlier, HPHA came together earlier this year as a result of COVID-19. And more specifically, we worked in collaboration with the Coalition of Asian American Leadership to write a report titled The Race to Close the Disproportionate COVID-19 Death Rates in Minnesota's Asian Community. And what this report highlighted was the need to disaggregate data because as we're being grouped in the larger race group Asian, we're misrepresented in how COVID-19 is actually impacting the Hmong community in specific. And so we found that when we disaggregated the data, Hmong individuals make up only a third of Minnesota's Asian population, but we made up almost half of the COVID-19 deaths in 2020, which, you know, in terms of epidemiology, that's an overrepresentation of deaths in that community. And so this led to monthly meetings with the Minnesota Department of Health to discuss the creation of the statewide demographic data standard, where large race categories like Asian are disaggregated to include, you know, Hmong, Vietnamese, Laotian, other small groups that usually aren't categorized or included, right, in data collection. Because we know that if we don't have disaggregated data that is robust and consistent and accessible to communities, right, then we can't provide the support and resources that those vulnerable and disproportionately impacted communities need. And so I can't answer your question on, you know, why, because, you know, it could be, you know, the same reasons as it is for any other community. But yeah.
Well, thanks so much, Mai. And I want to say that I totally understand that you and Jason are not COVID experts, but you guys are coming from a public health perspective. And obviously COVID is something that's really affecting our community. And so I was wondering, you know, what can our community do to educate ourselves about the vaccine, to not just the vaccine, but the virus? How can we safeguard ourselves? And most importantly, how can we protect our most vulnerable family members?
Yes, for sure. And this is always a tricky situation, right? Because in any community, we are gonna have some individuals who just aren't willing to you know, change their, you know, health behaviors, right? Behaviors are really, you know, hard to change and they take a long time. And so my suggestion is, you know, as we've been saying, is to follow advice from trusted public health organizations like the CDC or, you know, the Minnesota Department of Health or your local, you know, public health department, and ensure that the information you're receiving is coming from trusted sources. So even if you see something on social media, make sure that that's coming from a trusted source and not just someone who, you know, is writing, you know, what their opinions are, that's not, you know, evidence-based. It's also essential that those who are able to get vaccinated, because a lot of times our vulnerable family members are those who can't get vaccinated. And so, you know, get vaccinated and continue to wear your mask and social distance. And for those who aren't able to, you know, or have lack of resources because they have limited English proficiency, or they, you know, prefer to read or listen to things in Hmong, there are Hmong resources out, COVID-19 resources out there, developed by local, health departments and the Minnesota Department of Health. And so share that with your friends and family if they're looking for something more culturally appropriate or in terms that they're going to better understand. And, for those who refuse to follow safety recommendations or get vaccinated, right, the only thing we can do is to model safe practices for ourselves, right? Because when we get vaccinated and we wear a mask, we're not just doing it to protect ourselves, but we're doing it to protect those who aren't able to get vaccinated. So.
I think you make such a good point about modeling that behavior, because I think that sometimes as we're going back into larger social settings, if there's just one person or two people who are wearing, then it almost gives permission for other people to wear. And I think that people are very understanding. So, not only model, but by modeling, you give permission for people to be vigilant about their health. Jason, I have a question for you. Mai was talking about some of our most vulnerable folks in our community, which tend to be kind of our elders. But I'm interested also in how are young people reacting to COVID, and in the Hmong community, how are young people reacting to COVID? And I'm wondering if you can share with us, what are some effective strategies to encourage young people to get vaccinated and to still abide by some of the guidelines that you were talking about, the social distancing, the hand washing? I can imagine those are very hard things to convince young people to do. But what are some effective strategies that you've seen?
Yeah, thank you for asking the question, Paku. And that's a very hard question, all right? Because there are so many factors that influence Hmong youth and young adults, and so some people are still in school, and so when you're in a group setting, it's easier for COVID to infect. To get infected and to transmit COVID. Some people are working in places that directly exposes them to COVID. So whether that be grocery stores or in other settings where they have to interact with customers. And quite honestly, people want to hang out with their friends, right? We've been in our pandemic for 2 years. Hmong people miss being Hmong, right? Le sa mo gong ku tin ning cha, le sa mo na mo ho, le sa mo gong gong zong tia New Year's theo na bu yo che le la nya che na, right? And so and I don't work directly with youth anymore, but what we have used in the past is called peer-to-peer education model. So it's teaching folks how to have or having conversation with close loved ones so that they are prepared to answer questions and have conversations with people outside of your family or your friends group, right? So it's very important to have conversations with adolescents, youth, and young adults, and even family members, this is why our family got vaccinated. These are the people we're trying to protect, and and we're getting vaccinated. And it could be very honest, we're getting vaccinated so that we can return back to normal, right? So that we can hang out with family and friends, and we can go to the parties and be safe, right? So it's very similar to what Mai mentioned earlier about practice or modeling really good health behavior and teaching young folks that to have these conversations so that if they do go out to their friends, especially if they're in high school, and it prepares them to have those types of conversations with their friends, right? So because if you cho nè thấy chỉ thấy cho po thấy cho ở giờ lỡ thế lỡ hại bé mà bé ô to hay tiệt cho lọ hại bé xí giờ tất mà cho lọ hại cho lọ cho ô lỡ tiêu mất bé chạy lỡ rồi so you cho tao mà kia theo mà kia cho lọ tới cho yo còn lọ bỏ tiệt ô bé một sát chua mà bị chia tiệt bé sát chuaเราขอเราหายได้เราอยู่กับเป็นมุชาชั่วได้สิเป็นมุชาชั่วที่ไทยเป็นตัวเข่งเป็นมุชาชั่วที่ไทยเป็นเนี่ยถ้าเป็นสีเป็นมุที่ไทยเป็นมุชาชั่วที่ไทยจะโยถ้าเป็นมุชาชั่วชาชั่วก็สักกี่มอดพอได้เยอะเลยเนี่ยตายเลยนะ right? So then that way when they go to school or when they're with their friends and their friends ask them like, hey, did you get vaccinated, right? Then now they have the knowledge like, well, I my family got vaccinated because we're trying to protect grandma and grandpa, right? And
I love that.
Yeah, because we're Hmong people, right? We live in multi-generational homes. Like, oh, bỏ đây dân đã bên nhau nè, tại đã lâu là chỉ lo tiền sản đã bên nhau. Oh, trời ơi, thế là ôi một cuộc
I
cho tu sinh tử
love
thế chạy
that.
sinh tử thế à.
Yeah.
So it's really training and equipping our community members with the knowledge to have conversations with their friends.
Yeah. So my sister-in-law said to the nieces and nephews, if you want to have Christmas with the whole family and then that's why we're going to have to get vaccinated, right? It was very concrete. They were like presents.
Yep.
Okay, we'll get vaccinated. Thank you so much, Maya and Jason.
Yeah. And I appreciate that, Jason, because I think fundamentally this is the thing. It's like, and we know this from doing organizing work, like how are you meeting people where our values are, right? And for a lot of Hmong people, our values are for our family, especially for our elders, right? And so as well as for our young people, our children too. And so I think that's just brilliant in a way that we just tap into the values in our community and share those stories that a lot of people can identify with. And so I'm gonna, instead of a question, I said I was gonna share a story. Like my family, we had, and what I find powerful, we were just chatting about this before the call, the Facebook Live started tonight, was that a lot of people see this as an individual issue, but the reason why the work you're doing is on a more collective, aggregate, whole issue, right? And so for me personally, I had a family member pass away of COVID in this past year. And so, and it was absolutely devastating to my family. What we also didn't realize was how much of a financial impact it was actually going to be. And we realized that it's not, the lesson I took from it is and the person chose not to be vaccinated. And the lesson I really took from it too was like, nobody has hospital money, right? And so, the healthcare system is still very expensive in this country, and unless you're on, like low and you're on Medicare, Medicaid, it is extremely, cost prohibitive. And so, I just, I know Jay's question will talk a little bit about some of the hardships, but I did want to share this piece around the fact that, and I've had to tell people, like, and even if you were to stay in the hospital, even if your loved one was to die, if you have any assets whatsoever, Medicare can take that back. I have a family member going through this right now, actually.
So Terry, em lo mong
Yeah.
so even tell you do more insurance la, so you more COVID and mong more you see na puya insurance you cover la you training
Yeah, that's what you tell them. Like what they do, like you like they show still like you samu touch with na. It was good. The she touch. Yeah, that she hot. The có bộ môn như một hồng mà, cứ hay nên dân gia nên nó đâu có ít xe bây giờ lâu nè. Giờ ta chỉ nói cái, tới giờ có đâu mà chỉ mà hàng, đó chỉ ít bộ percent đó, chỉ tới giờ những một bộ hồng đó, họ chỉ ta lên đó tại hồng bút ta lại đó nè. Đó chỉ giờ tới yêu trường một bữa này chỉ yêu trường thể cho nó lên đó, họ chỉ ta lên đó giờ tới yêu mua tuần hành đó xe, tuần hành đó chỉ mua che, mua J, mua A, đó chỉ Medicare những, mua C, hay tới này chủ sự thể cho nó on đây chứ nào. And so because I care cho nên chỉ mà nó tới giờ tới này bốn mua tới giờ chỉ cả một sát chua lên nè, hai đô lỡ nông lên đó mà, này bộ mua chỉ hở một bữa hồng mẫu. PTO nữa, chỉ hợp về nữ mua, họ chỉ tạo lên là này bốn mua nhiều một về họ mua sana. And so kusa nông Jason that might the donate the game ko both ne go to public health. That she in addition, you're looking at aggregate health impacts, but we all know the social determinants of health, right? Economics. And so if there's any reflections on the comment I just made, because this is something I've been really passionate about for a while now. So Maya or Jason, love to hear your response.
Yeah, that does bring, make me think about the town hall that we hosted earlier this year in March, where we invited community members to come and share how COVID-19 has been impacting them. And it's been a lot more than financial, right? It's also a lot of like mental health, grieving because you're losing lost ones. And, the way that we grieve is very intimate, right? We like being around that person and, showing affection. And so when, we were hearing from our community members that they weren't able to be there with their loved ones, at the last moments of their life. and how heartbreaking that was, right? To be able to do that. And then on top of that, right, we our funerals that, you know, traditional Hmong funerals, right, we have hundreds, if not thousands of people who come to these end of life, you know, celebrations. And those in itself cost so much to hold, like, you know, a funeral. And so if you're having like a few people in your family who are you know, a victim of COVID-19 and passing away, that puts a lot of financial strain on your family, because, you know, people aren't expecting, you know, so many people in their families to pass away, and then having, you know, no money to bury their loved one, let alone pay for hospital bills, right? And so it creates, you know, such a more complex situation because of our cultural, you know, practices as well. Yeah.
Thanks, Jason. Yeah, any responses or reflections from you?
I think the only thing for me is that I'm a like firm like advocate and believe in vaccines, right? And that, like, you know, we are now a year into almost a year into when the vaccine was first started giving started giving public health vaccines to the general community, right? So it started in February, right? And I think when I was still working with St. Paul Ramsey County Public Health, and when in the community conversations that I joined, a lot of folks are like saying like, oh, we want to wait a little bit longer to find out more about the vaccine. You know, we want to wait. Like we plan on getting vaccinated, but we will want to wait to learn more about the side effects, right? And so my push and my encouragement for community members is that, like, you know, we know now more about the vaccine. There is more information that is out, and the vaccines continue to be safe. You know, I will be very honest too that there is a small percentage where folks may have a severe allergic reaction to the vaccine, but the positive side effects of the vaccine, or the positive benefits of the vaccine, far outweighs the negatives of the vaccine.
Jason, in my bitu no to Terry Taminji hata to ni chitaning toki to come on no poku to face economic challenges le tamai ka ha more mental health more trauma no. Ele no upelo lamna sotano to county hatsi no more resources to pang ichetoning to Joe to come on all your key to come on look with more economic challenges, more mental health needs.
Yeah, thanks, Jay. So yeah, earlier, we know that our community is grieving and, you know, experiencing a lot of isolation, we're a community that's used to being around so many other people, and we've had to be in isolation for 2 going on 3 years now. And so it has, you know, impacted a lot of our community's mental health. And so, you know, there may be times that we do need to access, you know, mental health resources or reach out to other trusted advisors to talk about our mental well-being. And so, you know, if you're seeking mental health services, to consult like your primary care provider or, you know, your regular doctor that you go to see. Telemedicine is, you know, a big thing now, so it's very accessible to seek mental health services as well from your home. But in terms of like any specific, you know, mental health resources, your primary care provider in your local, you know, medical network is gonna be more aware of what other cultural relevant resources there are for you.
What are, I mean, I know that you noted that you're not a medical expert on this, but I'm just curious, you know, on top of your head, you know, what are some signs that there are mental health challenges? What should we be paying attention to in our family members do we care for that? We can say, okay, those are symptoms of this person is in need of help.
That's a great question. And as you stated earlier, I'm not a medical provider, so I can't provide you with, a concrete list of, what it's gonna look like. Because the truth is, it's probably gonna look different in everybody as well. And so if you have concerns, reach out to a licensed medical provider.
And then are there any resources for folks facing economic challenges?
I believe there were in the beginning of the pandemic, but it's locally based. So your local health department or county will be able to help you get access to those resources.
Okay. And Jason, for cho tôi nên cứ chút tao sang cứ cho nó cứ cho cái cú sang bao mình chỉ chú hay là bao nhiêu mong sang từng booster sang nó bao mong cha tao có chơi nhóc có tí bao nhiêu mong lấy can trả lại một sang tao từ booster là từ từ cho
Yeah, chị tôi lấy khó cú báo chị ý giờ tôi có xã sát chua nó chị có tí tô có lúc primary clinicแล้วก็ตัว primary care physician khó có mua qua cho xongนะchị giờ tiền là mua chua lấy giờ tiền là chua ý công chua chị có hồ đồ lỡ chị là mà lấy tỉnh ít có sĩ hở thế chạy đâu có một sát chua chị còn tới khó ý khó chị nhớ hồ Ramsey County nó chị là mua ít cho community clinic sát chua tàu đồ sát chua đỡ bù đâu sợ đỡ nữa chị là từ sáu tông giờ tàu chí ý tàu chị ý cho xuân chị đã cá hay rồi gì từ sáu tông giờ tàu chí ý tàu chị ý cho xuân nữa chị luôn từ sáu tông nói giờ ít lúc automated phone line chị chỉ muốn nên tế tất mà có lo lù thia có lúc sáu tông thia có luôn bề chị từ lúc họ của báo chị là mà đi đặt cá hu rồi có anh đó có thản nữa thế là mà lấy ba con thấy công chua là chỉ tụ công booster nữa or giờ để cho nên lo you can visit www.ramseycounty.us to find vaccine clinics in Ramsey County. Same thing with Hennepin County if folks live there. Nhất là Hennepin County, kể từ số tông nhất tàu Bay Blau Yi cho xuân số tông nhất tàu Bay Blau Yi cho xuân chị từ lúc của báo chị do có phone line thế chị có lo lù thế chị có tụ luôn bê tất tụ số tông kia mà lấy đặt cá hữu tí tao con nữa the website is www.hennepin.us and their website also has information of where you can go get a vaccine dose.
I wanted to add that, Jay, I just wanted to add that I know that I tried to get I've got my vaccination, but when I was trying to get my my booster, it was going to be like a couple weeks out at my clinic. And so what I just did is I just went to, there's a clinic at the near the Mall of America. And that was so simple. And I was able to get in the next morning to get my booster. And then on top of that, this past week, we had to get some quick tests because someone in the family had been exposed to someone who had COVID. And we were able to rapidly get tested actually at the airport on the second floor, I think in the blue ramp. And so I think you're absolutely right, Jason, like you can go to your provider and that's awesome because it stays in your system. But if you need it really quick, there are other facilities and they're right around the airport, the Minneapolis Twin Cities Airport.
And real quick, Jason, you just show you have Hmong that you who the cato you they you dana.
Dạ, trên lệch của báo giờ thì có hỗ trợ từ số tông của món tử giờ thì có chỉ báo luôn mi cả có hay luôn món chỉ có ổn định có là luôn chỉ có hay thì của giờ món theo của sản phẩm món thả chỉ có là luôn chỉ tụi nên ở tế giờ tụi nên ở sai số tông tử chỉ giờ thì lần họ là luôn món chỉ lần thì ấy tụi mà lần mình thì tụi món đặc á hụt tí tóc con nó.
Okay.
Jason, we have a few questions from some of our live audiences, and one of them is the booster open for everyone right now, or are there phases where they're allowing people to take it?
Yeah, so there aren't phases to the booster, but there is a timeline. The timeline is if you receive Johnson and Johnson, you have to wait 2 months after the dose to go get your booster. So, for example, if you got your Johnson and Johnson vaccine in March, you'll have to wait until May to get your booster. If you got Moderna and Pfizer, then you have to wait 6 months. So for example, I got mine in March, and my 6 month time span is, I believe, August. And so it's after August. I don't know if it's actually August, but it's after August. So now I can go get my booster. So those are the recommendations for Johnson and Johnson, and then also Moderna and Pfizer.
So你只用그 양당特그 vaccine 보도 더 콜라와 저뭐 뭔데 게 말레 slowly 루죠 저 인자닝 게 말로 저로 게 하다 신호 저 점이 뜨면 저 양괴 스쿠너 그 찬초노 보면 또 보죠 체크한다 이대로 체크한다 보이면 저 초노 창하려요 보이면 chẳng có thời gian tới nhớคือở đây của ý lãnh sĩ ý lãnh này của một mình do cần đợi bớt tốt sản xuất bố một có thể bố khai sản phẩm bố thực cho hàng.
Yeah,这里考古包但是呢叫只用到手了差到讲 Pfizer，講 Pfizer 就講嘢差到就只用到手和講 Moderna 就一個只用到手呢，叫差錯呢กูcho chế cần đóกูsport để cho tôi cho xa theo đó khó cho ý tại sao cho chế cần đó chỉ ít cho xa hỏi cho chỉ xa đó làกูchỉ bởi để giờ lúc chế cần đó từ đó là mà giờ để nơi khu do Ramsey County tu sở đông của một độ nơi thia giờ để nơi visit ở website ramseycounty.us thia hennepin.us chế lỡ mua當到啲落圈子，就係條冇差錯嘅，要差你隻天，要做到咩個 appointment 呢？對你個個保嘅你只 accept 話緊，所以等你冇嘅到碌 clinic，都做你只個差錯嘅，到上邊我哋你都冇差錯到。
We have another question here. I'm not sure if you both can answer it, but if you can do the best you can. The question is, can you share the after effect conditions from COVID? I'm assuming the impact after getting
COVID
the virus.
Are there lingering are there lingering effects of after getting COVID?
Yeah, I can share a little bit when I worked with St. Paul Ramsey County Public Health. So some of the side effects, it varies greatly depending on who gets it. So
Is it after getting the COVID virus or the COVID vaccine?
Oh yeah.
So I'm assuming the virus.
Oh okay. Yeah, chị chắc chắn ta lờ rồi mó lý trả theo mó nhà lý trả chị cho nó học của báo chị it's very mild so nếu chị mó lo để chị mó nhà bộ rồi tôi chắc chắn nữa giờ lý bị sao của mó COVID á chị của chắc chắn ta nữa chị họ của mó của cái symptoms chị của cái chân trên mình chỉ theo của hông mình chỉ到一努了努cái tất cả都chị của rong但是嘛của mó COVID chị của到 quarantine của lâu nữa chị của整nhớ quarantine nữa chị nhớ quarantine chị tới cho có từ thế của nhớ của lúc hông isolation nữa họ cho cho chắc chắn nữa chị it can be very severe where they are hospitalized or they could have very mild symptoms like me. Or they may have no symptoms at all, right? And that's the risk with COVID-19 is that because the symptoms are so wide and so broad, we don't know how it's going to affect folks, and we don't know the long-term effects of how COVID will affect people. And so that's why we highly advocate to get vaccinated, because folks who get vaccinated, if they get COVID, their symptoms will be very mild, similar to mine, or at least they won't be hospitalized.
So Jason, kusa halo memang juga kusa kape jo ketingin jangan kau cakap tanah. So petangkan hana kau hata lo kau tu sah chua onde na, then kau mau COVID no te juga kau cuma hin. cô là có cho tao sáng chua để có mỏ COVID nó tệ thầu có những cho tao mỏ hình ha cô tê rồi có mỏ hình nó bây giờ cô họ ổn tệ họ chỉ chính chấp mà có họ chỉ luôn mà có hạt là you sáng công ổn tệ nữa you tụi mỏ họ vaccine ổn tệ nó tệ nhưng mà mỏ tệ họ nói họ bán thái con trong tham rồi nó bây giờ
Yeah.
okay.
Terry, did you have a question?
Well, just Jason, can you just share also what ages? The first question from the audience, what you can get a booster for? Because I'm a parent, I had to look this up. So, what ages now?
Eligible.
Yeah, eligible. Muốn nó công bế vì thai COVID nè.
Let's see. So tôi liệt họ hành the MDH website nữa. So swallowing cho tụi có đầu hướng đó số cái là chắc đó công booster. Đó là yếu chủ đầu họ là công chúa cái Johnson cái yếu chủ đầu li ở li đó cả là thơ công đó. Họ yêu thì yêu Pfizer thêm Moderna cái là chủ đầu li đầu li nữa. Đó là mà tôi liệt họ cũng nhận the MDH website cái swallowing cho tụi có đầu hướng đó số là chắc đó công booster.
So hopefully so that last question too from the audience about the after effects, long haul COVID, right? And I have close family members who had COVID before vaccinations are available, still lingering side effects, loss of smell, loss of taste, right? So it's real. And so my in particular, do you think this is something of the long haul? What do you envision as the continued activities for the Hmong Public Health Association? And do you envision like capturing this data about long haul and how it's affecting some of our communities and others?
Yeah, for sure. I can say our work with the Minnesota Department of Health, which started from the COVID-19 pandemic on this statewide demographic data standard, is going to be a long-term project for us. Because it's not only going to impact the data that we collect on COVID-19, it's going to impact, hopefully all healthcare related data collection in the state of Minnesota, right? And so, once we start getting that data, we'll be able to, look at more of the long-term effects of how COVID-19 is impacting our community, right? And the reason why we're advocating for this data to be collected is because without this data, we don't know, right? And so right now we don't have a lot of data to work with to, look at the impacts of how it's impacting the Hmong community, other than like anecdotal, evidence. We don't have anything on a population-based scale. And so that's one of our, HPHA's long-term projects is to continue working on the demographic data standard. And one of our potential projects could be to, work on another report, down the road, but, things move slow. We still need the data to be collected in order to do any of that stuff. And so we're going to continue to push forward on our current, data standard work with the Minnesota Department of Health.
Like we might need data for lawmakers to make policy about us, right, Jay?
Yeah, it's funny because I was going to share that I actually work for a nonprofit that's doing a survey right now in the Hmong community about access to COVID. So I'd love to connect with you all afterwards too. But then before we wrap up, I just want to give you both an opportunity. If you have anything to say to the community before we close up.
I think the only thing that I would share is to continue with the guidelines set by CDC and MDH, right? So social distance if possible. If social distancing is not possible, please wear a mask. Practice really good hand hygiene. Thia dạy tiếng mò hồng minh chỉ lần dư là nhớ chế li cổ bao nu cổ bao chứ chính là chỉ mò lời kia mà đã cá tự đông thia dạy tiếng tao nó chỉ sát chuối thế li thì tại taoอยู่ตัว kinh thiaอยู่cho chính rể nhớ rể đượcอยู่.
Yes. And in addition to Jason's wise words, I think just some words of encouragement for our community who feel like this pandemic is never going to end, our Hmong community is so resilient, and we have gone through so much and survived. And, you know, we've experienced a lot of trauma and a lot of loss and grief. But, you know, we have great Hmong leaders in, you know, public health and the medical field that are, you know, we can look to for support. And so I just want everybody to know that they're not alone, and we will get through this because we are Hmong and we are resilient and we're strong.
Ocho Jason ha mai cứ mấy chuyện mà mấy cái luôn nhong to con cú ha bằng cú ha chơi shi tạm zu từ cái mà COVID có cho nó giờ nó mấy cháu nào có chỉ nhân giờ hoàn toàn chơi mà nó to con bé thò mấy số cột là bằng bu con do con dư thò mấy tập trung more resources 如把每个时也没上门go to test 了也上门参出了也没有么就的 Lu County 了就是 Lu municipality 可能样的在乎NC County 哈那边 county 就是一般那边嘛么就刚么就是东哈把 contact 了没找到这个没说了到包没上么到的是Terry ha Pagu that's a wrap for another show this week. Do you both know what our next show, when our next show is going to be, and what we'll be discussing yet?
Well, we're going to be figuring it out, but just know that stay tuned. When we do come back, we will be doing kind of an insight into what's going to be happening at the legislature in 2022. It's going to be a really big year for elections in Minnesota, so we'll be talking a lot about that. What might be interesting is what we might be doing with this $7.7 billion surplus, right? Jay, sorry, I'm just picking on you, but yeah, you know, there's lots of things happening, right? And so that we need to pay attention to. So stay tuned here.
And also, I mean, all the maps are coming out, the redistricting maps are coming out right now. I know the House has released theirs, and I think we have until, I want to say February, until the court might have to step in. So I'm imagining that that's going to be a topic we'll be talking about in the new year.
All right. Thanks, folks, for joining us for another night here, and we'll see you again.
Thanks,
Thank you,
everyone.
everyone.